So let's talk about data we're collecting at the point of care, and it's interesting because that data sort of changed as the pandemic went along, and where were going to report it changed and then changed back. So, are we collecting the right information even today at the point of care with regard to? I guess there's a lot of different perspectives, right? Utilization of the health system, utilization of PPE, but also the spread and those kind of things. Are we collecting the right information? Are we collecting too much information? What's the status?
Yeah, I mean, listen, I think we have decent visibility on the pandemic now. I think we miss, when you start to aggregate geographies, you start to miss certain details in terms of race and ethnicity and disparities and granular differences that make a difference in this pandemic, right? We know that certain communities of color have gotten hit much harder, rural communities have gotten hit much harder. So oftentimes the data that gets presented isn't at the level of detail or doesn't have the attributes that allows us to fully understand. And we know that those kind of data elements are super important. I mean, we know that with that kind of knowledge, you can properly intervene or set up testing or improve communications. Of course, now with the vaccine, like how do you target vaccination clinics to the places that need it the most? We're not necessarily using, either we don't have all the attributes or we're not using those attributes in the best possible way to inform the response. So that's been a problem from the beginning. I think it definitely got better. But, again, we're not the best in, as much as we like to talk a big game about using data to drive decisions, whether it's healthcare or public health. I don't think sort of that is necessarily, especially when it comes to real-time response, I don't think we do a good enough job in that space.